We're sitting all day, every day. Over 4 million Australians who suffered with lower back pain. A lot of people are living in pain unnecessarily. The body will recover if you teach it how to move well. The biggest misconception is that when we are injured, we need to stop exercising altogether. Movement is medicine, and there's always something that you can do. If we stop it altogether, we get good at doing nothing. And it makes it so much harder to get back into movement. In order for people to move well, they had to learn how to move well in the gym. The world's your oyster when it comes to movement, honestly. There's really no excuse. Every single movement is rehab when done correctly.
This is Fernwood Unfiltered, the podcast with straight up expert-backed advice when it comes to women's health and fitness. And today, if you are trying to get stronger but keep getting slowed down by pain, niggles, or confusion about what your body actually needs, and you're craving clear, no-nonsense guidance that you can trust, this episode is the one for you. Dr Dani Antonellos is an osteopath who specialises in exercise rehabilitation and has been in the industry for more than a decade. Her methods as a practitioner encourage her patients to feel educated and in control of their results. Dani also hosts her podcast Level Up with Sherelle and Dani. Her mantra, movement is medicine, demonstrates that movement is the long-term solution for optimal health and performance. Dani, for everyone who's listening to this episode, what's the one thing that you hope they take away from our chat?
Movement is medicine, and there's always something that you can do.
I'm so excited to get all of your thoughts on this, but also fun fact before we get into our full discussion, you're an extra special guest of ours, Dr. Dani, because you used to work in Fernwood clubs. Is this true?
I did, and it's just such a pinch me moment to now be here with you. And even last month I was on stage at the Fitness Expo talking and sitting next to Diana Williams, and that little girl when I first started in 2014, would be pretty proud because back in 2014 I did apply for my first real personal training job, and that was at Fernwood in Mitcham. And it was a real turning point for me because fresh out of the industry, just so eager to learn, but still very reserved because there's only so much that you learn in your Cert 3 and 4. But then the real work starts when you actually get on the gym floor and you have your first client with you. They don't know they're your first client, and away you go. And I'm so grateful for Fernwood and the senior coaches that really took me under their wing. I don't know if they felt a little bit sorry for me at the time. She doesn't really know what she's doing, but we all start somewhere, So I will always have a soft spot for Fernwood, and I was there for 2 years and sort of moved on after that, just gaining more experience in different avenues. But yeah, so it's really special to be here actually, and I look forward to talking to you about some cool things with movement. And I know a lot of the coaches and the listeners will hopefully take a lot away from this.
So, I have absolutely no doubt that they will. Based on your real world experience, what was the type of woman that you worked with, the Fernwood woman?
A lot of them were actually, they were super busy in their lives. A lot of had kids, their own careers. I just love women because we're so selfless in a fact that you just want to make sure everyone around you is okay.
Yep.
And that's what really drew me towards the first women's gym. I wanted to give back to women for giving so much to other people. So a lot of my clients, they were family people, career-driven, had kids, but they did prioritize their health and well-being. And that is, such a great foundation to have because we have to look after ourselves in order to look after other people. And that is just so important. So, my Fernwood clients, I'd get them into even a little bit of boxing for those who are comfortable, the strength training, just even from back then, just breaking the stereotypes because I loved weight training myself. And we already started to see a shift in, women can pick up the weights, and which we will get into a little bit later. But back then I was sort of encouraging my clients, no, let's go heavy on the leg press today, or we'll do a bit of our boxing and things like that. So it was a really good cohort of people, and maybe they're listening now. So hello, and thanks for booking me back then 10 years ago.
What do you think it was that drew you towards this field in the first place? Do you remember? Had you always been active, athletic?
No, actually.
No.
Yes, you'd think so. But I was the kid in high school who literally got picked last. It was so embarrassing, like in the sporting teams. So definitely did not grow up active until one day my parents sort of had a mini intervention with my brother and I and sort of said, okay, guys, come on, no more video games. You need to get active. We're going to start playing tennis. So that was my first sort of sport that I played, and that lasted about 15 years. In that came the gym. I started the gym when I was 16. Now, my dad was a bodybuilder. So during my time as a young kid, it was quite normal for my brother and I to watch dad get super lean and muscly, put on a fake tan, then stand on a stage. And we were like 5 or 6 years old, and that was totally normal to us. But the seed didn't get planted. I think we were like, okay, that's dad's thing, a little bit weird, but whatever. And then lo and behold, 15 years later, I ended up doing bodybuilding myself and competed in 5 shows. But yeah, it was a sort of gradual progression of just being active and trying different things until I realized, well, I can control the gym and bodybuilding and the times that I went in. So it was more that factor aside from that's why I left tennis, because I thought, I can't really commit now with uni and all of the scheduling. So what can I control? The times that I go to the gym. And then, just saw that through until about 2019.
At risk of going off on a tangent, what is it like at a bodybuilding competition? She says, obviously, as someone who's never competed in a bodybuilding competition.
I mean, it's really interesting if you don't in the crowd. It's really interesting if you don't know what you're looking at.
Yeah.
But it was such a great experience to do it, and that's why I kept coming back and ended up turning pro in 2019. And it was just when lockdown happened, sort of losing about 2 or 3 years of that. As a woman in my 30s, I wanted to get my hormones right and all of that. But I really loved it. I mean, personally, I think being on stage was the least favorite part, the posing and everyone's watching you. But the person that you have to become along the way, just like with any goal, any sporting goal or, goal that you have in your life, you not only go through a physical transformation, but the mental transformation. And you have to stay really strong to get there in that final moment on the stage. All eyes on you. Everyone's looking at you. You have to know that you left no stone unturned, and there was something really cool in that.
We've been bodybuilding. We obviously were a PT. What then led to your journey to be an osteopath? Where did that come from?
Yeah, so for those of you who don't know, osteopathy is traditionally hands-on therapy. So massage, dry needling, cracking, manipulating the body in order to achieve a pain-free result. Now, I don't actually practice in that way anymore because the worlds were just so separate in a sense of your university studies. So osteo, physio, chiro, and your personal training felt so far away because you had all of your hands-on therapies and then your movement-based therapies, but they were very separate. So I thought that if I were to go to uni and study osteopathy, I'd be able to teach people how to move in order to rehab injuries, just because I wanted to be a little bit more qualified. Like, not to take away from personal trainers, because some of our biggest clients now in our courses are personal trainers. So, but back then I was just trying to find myself, a little bit of trial and error, thought, okay, I want to go to uni because I just thought that was the next step after high school.
Mm-hmm.
Ended up enrolling in osteopathy for a 5-year degree. This was at the same time as my personal training and bodybuilding. So there was a lot on my plate.
But did you sleep at this time?
Not really, to be
Surely
honest.
no.
A couple of mental breakdowns, but a lot of early mornings and late nights.
Packed schedule.
Some of my friends did help by sending some of the quiz answers my way at uni, so shout out to those guys. Thank you. But it was a lot to juggle, and it just didn't really feel right. Even upon graduating, I nearly didn't finish the 5-year degree just because I did enjoy the hands-on therapies. However, passion always lied in the gym and teaching people how to move. And I think the biggest red flag in my eyes was my university lecturers started asking me about movement, which was a little bit, I thought, okay, I'm teaching them things. There's a bit of a disconnect. So after I graduated, I started working at a couple of gyms and came across many amazing mentors, but there was one mentor who stood out, and it finally let all the puzzle pieces come together because he was actually practicing as a physio but wasn't hands-on as well. The reason why I don't have much against hands-on therapy, except I just noticed that in order for people to move well for life and lifelong results, they had to learn how to move well in the gym. It wasn't a matter of, here's a massage, let's do this trigger point therapy or stretching, because the clients may have come back feeling better, or they may have left feeling better. However, they came back with the same things. So I thought, okay, yes, this is good for the books and rebooking, and my boss that I was working for was happy. However, and that's where the movement is medicine comes into it, because the body will recover if you teach it how to move well. So one of my mentors unfortunately passed away in February this year, Dr. Andrew Locke, and it was such an honor to work with him. Like, he's one of the world-renowned physiotherapists, and I think he saw something in me in 2019. I was just so keen to learn from him and always did the work and wanted to ask questions. And then we ended up going in business together. And that's my company, United Health Education, where we have all of our online courses and resources there. So even further, now him passing away, unfortunately, that just lit the fire even more to really just teach people his messaging through myself about movement being medicine, because a lot of people are living in pain unnecessarily. And I've been doing this such a really long time now, and it may appear easy to us to identify and how to rehab it. However, it's debilitating. It's people's qualities of life that's lost, and, mental health comes into it. We lose the social aspect if we're not in the gym anymore. Physically, we don't feel capable, and then we do rely on other health practitioners, for the answers all the time.
Well, I want to touch on that because I feel like there'll be people listening to us right now who have that little niggle, that bit of pain that just won't go away, and they're just like, well, that's just my lot. That's my lot in life. That's there. That's just who I am. Are you telling me that's not who they are?
That's right.
They don't necessarily need to be that.
Yes. And people do get comfort in that sometimes. It becomes a little bit a part of their identity.
Yeah.
Or it can also be an excuse to not take action, or an excuse, to not do this thing. Oh, I can't do that because I'm injured. And people start to really identify with their diagnosis unnecessarily, because we shouldn't be living in pain. And look, okay, there are going to be some 2%ers where, it can't be cured through movement. However, for the majority of biomechanical dysfunction, so your muscles, your ligaments, your movement patterns, if they're causing you pain, it can easily be fixed by fixing those movement patterns. It's, we can't walk around saying, oh, it's just who I am, it's genetic. No, you got to do the work, and then you won't have pain anymore.
At a risk of sounding this question being a little bit too basic for your incredible knowledge, what is the difference when you say hands-on therapy? Why does that work within a one session thing? So it's like, obviously that's where you went away from that because you weren't seeing a sustained result. Why does it work in that initial moment?
Yeah, really good question. And there's always a time and a place for manual therapy.
Yes.
So I'll just make that clear for any of our amazing manual therapists listening. But what I notice is when there's a dysfunction in the body or something that's not right, let's just say hip pain, really common. And people notice, well, the front of my hip is tight, my hip flexors. It's a really common one. When there's something happening in the joint, a imbalance of strengths versus weaknesses, or we've been sitting down all day, certain structures become tight in order to protect the joint. Now, that tightness causes pain signals and dysfunction and discomfort. So when we get our massage or our dry needling, it actually can help to loosen off the tight muscle. However, that tight muscle is there trying to guard the joint and stabilize. So it is short-term relief because we have reduced that tightness. However, as soon as we go back to our desk job or back to our poor movement patterns in the gym, that muscle goes back to being tight because that's its job, to try and protect the joint. So that's why manual therapy works short-term until you go out there, until you do what you do. So my way of treating it is, while we work out why is that muscle tight, we honor the tight muscle because there's nothing really wrong with it. That is literally the only structure doing its job right now. Which muscles around that joint are weak, And when it comes to tight hip flexors, it is often our glutes.
It's all connected. It's
all
always the
connected.
glutes. Yes.
It is.
So hang on. So what would you say is the biggest misconception then when it comes to exercise and injury?
The biggest misconception when it comes to exercise and injury is that when we are injured, we need to stop exercising altogether.
Yes. Okay. But which I feel is, for want of a better word, the normal assumption, right? It's like, I'm in the gym. Oh, my shoulder's not feeling great. Maybe I'll have to stop until my shoulder doesn't. There's no pain. Then I can restart.
Yes.
Right.
And that makes sense because it's good to stop doing the thing that's hurting it. We don't want to keep picking at the scab or, keep doing what is aggravating it. But if we stop everything altogether, then we get good at doing nothing. And it makes it so much harder to get back into movement because we've literally deconditioned ourselves and then we have other issues. So if we spend all day lying down in bed because we're injured or sitting down, then that's going to bring on other problems. So it's kind of, you get stuck in that loop. So rather than saying, well, we need to stop exercise altogether, we need to just check in, acknowledge that we're in pain and that's really annoying. No one likes injuries. Allow those feelings to come up, but then get really practical about what to do and ask questions. Was my training volume, was I doing too much in the gym of one movement? Do I not have a well-rounded training program? Like, am I neglecting my glutes, for example, and doing a lot of quad work? Which changes do I need to make and which weak muscles do I need to strengthen? Because my body's telling me something right now. Rather than stopping altogether, we get practical and find the weak links and strengthen those.
What have some of the reactions been to your clients when you've told them this? It's like they're like, oh, well, I'm injured, so let's just put pause on that. And you're like, no, I'll see you in the gym tomorrow.
Yes. Yeah. I mean, you have to give context. Yeah. I mean, as much as we want to say, no, if we give a good reason, and often I do try and explain it in that way, then they will get motivated to do so because yes, some people do get a little bit scared and we might have to baby them a little bit more into the movement, but a lot of people just really don't want to stop training. So it's actually comforting and empowering for them to hear that there is something that we can do. And even if it means, they've hurt their lower body, they're a little bit scared to train, let's just do an upper body session. Get their confidence up. They're in the gym. They're in that environment. Cool. Now let's actually play with the lower body and see what we need to work on.
Where do you think this misconception about you having to stop training altogether, how do you think that's snowballed over the years? Like why? Why do we think that? Is it the advice that we're getting or seeing? Is it the practitioners telling us this? Like where is it coming from?
Unfortunately, it is a lot of the practitioners and GPs giving out this advice. So as I mentioned in a long tangent before on my journey, at uni, we weren't really taught how to teach people how to move to the point where my lecturers were asking me for that help. So out of that 5 years doing osteopathy, we had maybe 8 weeks of some kind of exercise rehab, and that's nothing. Like you don't see the value in it. So if health professionals aren't learning it, then they don't know how to teach it and they wouldn't know how to give the right advice. So they're in their best eyes, they're saying, well, stop doing the thing that hurt you. And that's the advice. And then the patient walks out really deflated and upset because someone with a degree told them to stop, so they must be right. And that's just how it snowballs. There's just a real lack of education around movement, unfortunately.
Have you had clients come to you after receiving that kind of advice?
Definitely. And I've had so many, but there was this one beautiful client that I had a few years ago, early 20s, so still so young. And she had back pain. And she was told by a female therapist, little girls shouldn't be lifting heavy weights. And this was, it doesn't matter what profession they were, but it was a health professional who supposedly was meant to help with the body. And she said, well, why don't you go walking instead? Or why don't you take up yoga? And no, this person loved weight training. She didn't work in the industry, so it was her time to herself. She had her gym friends and she was in tears when she reached out. I think she came across me maybe in my podcast or something and said, look, I've been told this advice. Is there anything we can do? I said, absolutely. There's so much we can do. So we went through her assessments, worked out, well, her lower back was sore because she was just using it a little bit too much. And that's really common in injuries. The sore structures are the ones that just get used too much and then they become tired. Just like us, if we had no team members at work and we had to do everything, we'd become tired and
You get
annoyed.
a bit run down.
Get a little bit run down. And that's exactly when it comes to an injury, particularly back pain. So I noticed she was really good at using her lower back, reframed it in her mind, saying, well, your back isn't the problem. It's actually the solution. You're doing really well at using your back, but what about those glutes? They're not really doing anything. When was the last time you did a plank for core strength? Then she realized, okay, no, there's some loopholes in my training. We worked together for about 12 months and then she actually entered a powerlifting competition and came third in the world champions for her weight class.
Oh my God.
Because she was in the smaller weight classes, hence the little girls shouldn't lift, but she dominated and ended up, winning her coming third in the powerlifting. And I always share that on my socials and people are like, wow, what a journey, So it really just does take teaching the body how to move correctly, regressing accordingly if needed, and then progressing. And, it's limitless when you put the work in.
What would you say, let's just underline this, what would you say to someone listening, potentially a little girl who's been told not to lift heavy weights? What would you say to them right now?
Get a second opinion, because that's horrible advice, but get back in the gym. And if you need the guidance, find someone that can actually help you how to move. And you might not want to enter a powerlifting comp or do anything like that, but the world's your oyster when it comes to movement. Honestly, there's really no excuse because there are hundreds of exercises and variations. It's just up to you and your coach to find them, find what's right for you in that moment, and then just keep progressing one day at a time. It's never really a step back when it comes to injury. It's a reframe. Okay, I need to clean up my technique. Maybe I need different programming. I was probably neglecting those lunges because I don't like them. And now my body's telling me about it. So the clues are there. And when you do have exercises that you feel comfortable doing, then it's just so good for your mindset and it's really motivating and people feel in control of their body. A lot of the time we hand over that power to a therapist or a coach and because they know best. Well, let's just start learning about our body and actually giving ourselves that trust to be in control.
I'm quite obsessed by this concept of reframing. Reframing instead of just stopping altogether and being like, that is our lot, that's it, I'm done, packing up shop. But how do you know, or how can you tell the difference between a pain that is able to be worked on, moved through, progressed through, and one that's like, oh no, stop right now, you actually do need rest?
Yeah, really good question. And it's quite hard for people to describe pain. But generally, if the pain is sharp or shoots down the leg, tingly, it could be sort of nervy, then okay, well, that's not good. There's a difference between a sharp pain and a muscle working in the gym. So it's really important to be able to distinguish that or have that conversation with your therapist or coach when they're asking you, how does this exercise feel? Because a lot of the times people say, oh, it hurts. And the coach always thinks, oh, no, that's not good. But they just mean, oh, no, my quads are working. I'm on a leg extension.
Yes.
Normal pain. But we should never push through pain. That is the thing. Nothing that hurts should be pushed through. No matter what all those slogans were, no pain, no gain, they're redundant. No, if we get a sharp pain or something shooting down the leg or in the shoulder, let's just try something different.
You say it's about knowing your body. How have you gone about empowering women, I guess, who are coming back through injury, working through that, to be able to trust that they're ready to, if that makes sense? That, oh no, that might hurt a little bit, but it is okay, or no, it's all right, it's not going to hurt in that same way again. Like how can we trust our bodies?
Yeah, so let's just say someone has knee pain in a squat. And when they have a bar on their back at a certain weight and they're really traumatized by that. Okay, let's break down the movement pattern, have a look at their squat pattern. There might be a video that they took at the time of injury. So we just go through with them, was there a technique breakdown? Was the loading a little bit too big? Do they do too many dominant movement patterns that are similar to that squat and it's just putting too much pressure on the knee? Are they neglecting all the other muscles of the lower body? So you start to get problem solve, and then they have a comfort in a sense that you're able to discuss the reasons why. If you can give them a reason why it started hurting, then there's a framework for you to work around and work towards on the rehab plan. So then we might take the bar off the back. We might add a band around the knees to bring the glutes into the squat pattern. And then I would say, okay, perform a squat now. And it might not hurt because we brought, the glutes in and we reduced the load. So then there's a confidence in that movement pattern. So they think, okay, well, it's not me. I'm not broken, but I'm just not ready for that amount of weight at the moment or that movement. So you have to sort of not run away from that movement and say, oh no, we're not doing squats, they're bad, blah, blah, blah. Well, okay, let's just regress that movement pattern to a point where you feel okay and pain-free doing it. And then that increases the confidence. And then you give little checkpoints. Okay, next week we're going to do it without a band, or next week we're going to, have a kettlebell at our chest. So you always give the plan going forward as well. But there are unfortunately some people that, maybe disc herniations or that are in significant pain. Maybe, okay, we do need to change that movement pattern a little bit more so. However, still give 2 or 3 exercises that they go home and do with confidence, because they can't just sit there, with their hands in their lap doing nothing. Like, it's so disempowering. Always give a little bit of homework or some movement patterns that that they can do safely and pain-free. And then you just build from there every week or every day.
I think we're going to get into some of those homework,
Yes.
some of that homework for ourselves very, very soon. But I just wanted to know, what do you like in a gym when it comes to you're watching other people? Are you just diagnosing how they're lifting? They can't do that. They can't do that. No, just try it this way, this way, this way. Is all of that running through your mind?
I mean, I don't actively judge people, because I remember when I first started training at my first gym, I was 16, and one of the trainers came up to me and told me I was doing a tricep pull down wrong. And I've never forgotten it since.
Yeah.
For some reason, I felt so embarrassed.
Yeah.
So since that moment, I know that there's a really nice way to offer help to people. Thankfully, in our gym, we've got maybe 80 or so members in our gym in Sydney. Everyone's pretty open to discussion and learning from one another. But even just out in public, I'd be sitting with Paul, my partner, and just people watching down the beach, and someone's limping. I'd be like, yeah, that's a knee injury, or, oh, that person's right hip, they need to do a bit of glute work there. But not making fun of the people. It's just really interesting to watch how different people move.
Well, you've got an intimate knowledge of the skeletal system, right, as an osteo. So if someone's standing in front of you, you can probably be like, okay, well, that posture means X, Y, Z.
Yes.
Whereas I'd just be like, that's a person standing. You're like, well, they're standing because.
Yeah. You can't unlearn it. The biggest was sort of in lockdown when everyone went running, and you'd watch some of the people saying, oh, I don't know about that. Good on you, but ouch. That's going to hurt in a couple of weeks.
What are the most common areas or problem areas that women in particular can suffer injuries in? Where are we holding stuff? Where are we injuring ourselves? What's going on?
Yeah, one of the most common is lower back. And I think the report came out in 2022. There were over 4 million Australians who suffered with lower back pain. And that's not even everyone, because they're only the people who reported it. So lower back is massive. Hip pain, neck pain and headaches, shoulder pain, pretty much a lot, everything.
Everything.
Because we're sitting all day, every day, for the most part, unless we're out on the tools. But then we might have repetitive injuries, from being at work. So most of us have now, life has evolved. We're sitting down, we're on the computer for work, we're in the car, we're watching TV. Our body has molded into this C-shaped position. Our spine, our head goes forward, shoulders forward, hips are flexed. So we're not really using the muscles on our back. So upper back, our glutes, at the back of our neck, everything's sort of on stretch. And that is leading to so many dysfunctions and injuries, because we are spending 8 or so hours a day sitting down. And then we might go to the gym and go on the seated, leg extension machine or the seated row, but we're still kind of sitting. So then if you don't warm up or mobilize appropriately, we're still sort of molded in that shape. We carry that into our 1-hour gym session, and it's not really doing much. So that's where a lot of the dysfunctions in people are so similar, because we do have similar lives, but it's getting worse, unfortunately.
Well, shout out to our listeners who, during your answer then, just sat up slightly straighter and was putting their neck back. Have you seen those memes about tech neck?
I have.
Or those articles about tech neck? And it's as you said, because we're always on our phone scroll and it's like our necks go forward and we get this little hump on the top of our neck. That's the thing.
Yeah.
Really? Oh, God.
Yeah. Well, I mean, I'm guilty of it too. When I get excited, like I'm excited doing this podcast, my neck goes forward because I want to engage.
I was like, I'm so, yeah.
That's normal, but it is. You see some people looking down on their phones and their head's just horizontal to the ground, and our head weighs so much more when it's away from the midline of our body. And there were actually some x-rays done on some teenagers, and they grew little, their bones changed and grew little osteophytes. So the bones basically there's extra bone laid down to hold their head up because of their poor posture. So
No way.
our anatomy is changing to try and accommodate for our, modern day habits with technology. It's pretty crazy.
Oh my God, that sounds absolutely terrifying. But I think we need to get into some practical tips when it comes to helping our posture, combating those driving factors that comes to potentially our lower back pain, shoulder pain, neck pain, all of the pain. But if you are enjoying this podcast and you think that there are people in your life who would also enjoy this podcast, make sure that you share it with them because the learning is only just getting started. We'll be right back.
Looking for a gym that's welcoming, safe, and just for women? You have to experience Fernwood Fitness. Designed for women, by women, our clubs have everything you need under one roof. World-class strength training, reformer Pilates, yoga, luxurious change rooms with daily essentials, and even a members lounge with tea, coffee, and complimentary breakfast. Book a free tour today and feel the Fernwood difference for yourself. Visit fernwoodfitness.com.au.
So full disclosure, Dr. Dani, one of my biggest insecurities, and I'm being serious here, is my posture. And I feel like I've only really become aware of it. It probably started when I started working in TV because I wanted to look skinny on camera, right? So I would consciously be like, put the shoulders back, breathe in, don't breathe again. But it's now morphed into me just being like, I feel like I am in that constant C shape all the time. What's a good posture?
I think a good posture essentially is one that has somewhat of a balance between front and back and left to right. We're never going to be fully symmetrical. It's impossible. We will always write with our dominant hand or pick something up with our dominant hand. Workplace postures might always favor one side. However, we do need to spend the time offsetting the postures that we spend most of our day in. So for those of us who do spend a lot of time sitting down, we need to spend a significant amount of time strengthening the muscles on our back, strengthening our glutes, and definitely strengthening our core because our lower back is essentially holding us up, and that's where people get back pain from sitting because it's just the muscles of the lower back that are on stretch holding us up. Otherwise, we'd fall into a heap. So the core, although the exercises aren't that fun, holding a plank on the ground, side plank, they're pretty boring. I'm not going to pretend that I love all these movements. However, the results are amazing and it makes it so worth it when you just spend even 10 minutes a day on a little muscle activation sequence that does include your upper back, your core and your glutes. And it will just make the world of a difference, not only to your posture, but then how you perform in the gym as well. Like you will get the most out of your lifts if you're able to have a solid brace because your core is strong, or you'll hit your deadlift PBs because your glutes are really strong now. It's not just your lower back lifting that weight. So there is a huge benefit in spending that time strengthening the weaker structures.
So what can that muscle activation look like? Like if we were going to maybe attempt something right now that we're both sitting, full disclosure.
Yes.
Don't know we're not meant to do, but we're meant to offset the sitting. But if we're sitting down, what's something that we can do immediately for everyone listening that can just maybe help them in terms of their posture right now?
Yeah, there are some great seated ones. A lot of the work is on the floor, however, because we use gravity, but there's no excuse. There's so much we can do seated. So when it comes to neck and shoulder pain, that often stems from our arms always being out in front of us on a computer, on our phone. And our upper back becomes less mobile. So that C shape really does set in. So the first one, in order to offset shoulder pain and neck pain is actually some upper back mobility, which we can do seated right now. So if we cross our arms over our chest,
Crossing arms over, so hands to shoulder.
hands to shoulders, yes. And then now without hitting these microphones here, everyone's doing it in the room. That is fantastic. And we're going to use the back of our chair as a little fulcrum and then lifting your elbows up, but lifting up and using the back of the chair as a fulcrum, head up towards the ceiling.
Okay.
Beautiful, and coming back down. Good, and we'll go again. So really aiming for millimeter by millimeter.
And head goes fully back.
Head goes back as much as comfortable. Elbows up. Good, and back down. So we would do that about 8 or so times. You might hear a little clicks and cracks there.
I heard a couple of clicks in my neck. Not going to lie.
That's okay.
I was like, oh, God, my head's heavy. Yeah.
Yeah. And then we're going to put your hands down and then just do some rotations. So starting on the right side of your body, bring your hands around and just follow with your eyes and your head. So looking to the right, good. And then slowly coming to the left, turning all the way around, using that chair or your legs to grab onto. And we go back and forth again 8 or so times. So everything with muscle activation and mobility is light load, high repetition.
Right. Okay. So we're wanting to hit 8 to 10 repetitions.
Yes.
How many times do we do a set, if that makes sense?
Every hour upon sitting.
Really?
With that.
So we should do this every hour?
Yeah. Can I give 2 more?
Yes, please. No, please do. My goodness, yes. And also just a quick note, listeners, if you want to see exactly what we're doing, head to YouTube because the video is going to go up there. But yes, Dr. Dani, please continue. Give us the 2 more.
Okay. So rather than just sitting with our shoulders back, like maybe what our parents used to tell us when we were younger.
Literally me every second of the day. I'm like, oh, this will solve my posture. And I'm just there like, oh, this is it.
Because as soon as you stop thinking about it, they just spring back because our pecs are tight already. So they're pulling forward.
Yes. I am quite conscious of my pecs through here because I think I do drag myself down. And that's that C. Yeah, okay.
Yes.
Right. Yep.
Okay, hands behind your head.
Hands behind
linking your fingers together and then pushing your elbows back and squeezing your shoulder blades together. So this is not a stretch. This is muscle activation. So we're using our own strength to bring our elbows back. And then after 5 seconds, gently let your elbows relax a little bit forward and then back again. So we don't want to actually be pressing on our head. We're just using that as a little guide.
So that was for me, guys. I was definitely pressing on my head. Okay, don't press on the head. Just push the shoulders back. Yep.
Good.
Shoulders,
so again,
elbows back.
Yeah, elbows back. Again, 8 to 10 times. So if you're sitting at your computer desk at work, there's really no excuse here. And
I can feel this
what
one.
Can you feel? Where do
I'm
you feel
super tight. Left side's actually tighter for me than the right.
Okay.
And I can really feel it in my shoulder, I think. So like this.
Around the back?
Around the back.
Good. That's your rear delts.
Yeah.
They're doing their thing. That's really good.
And I feel like for the first time, maybe in forever, I can tell that I have shoulder blades.
Yes.
You know, sometimes I've been like, it's like I'll put shoulders back and I'm like, how?
Exactly.
Right?
Yeah.
I always feel like dumb thinking that, but I'm like, wait, am I actually moving my shoulder blades?
Yeah, and that's very valid because a good coach won't actually sort of cue the anatomy. They would cue the movement. So like what we did just then, and you explained that so perfectly. Yeah. You could connect with your shoulder blades for the first time. And I didn't have to say pull your shoulder blades back. It's just hands on your heads, elbows back, and then the shoulder blades will do their thing.
Okay, do you have one more?
One more, yes. If you are in the office or at home, again, just your simple chair squats. And we might not have to go through this now, but so just make sure your feet are in line with your toes or your knees and then pushing your knees out. That's the problem that people do with squats. Their knees cave in, so they're not using their glutes, and you see people get up off the chair and they're pushing either side on the chair, and it often comes with a few groans and coming up or leaning to one side. Well, no, we don't want to be those people. So we need to keep the quality of our squats perfect. So knees out in line with your toes, hands out in front of you, and simply standing up without letting your hands touch that chair. So it's a lot harder than what you think.
Yeah, I was just thinking that. I was like, for me to actually stand up, so just so you know, listener, again, you can watch it on YouTube, you'd see what I'm doing. But I'm in the position, so I have my feet on the ground and I've got my arms out in front of me. But the point where you're just like, and stand up without touching the couch, I went, huh? It was like my brain was very slow then to be like, work out how I actually would do that.
Yeah, all glutes and legs there. You can't actually cheat. And you will lean forward a little bit, but that's a natural movement.
Yeah. So again, you're doing that like 8 to
8
10
to 10. We'll keep
times?
it at 8 to 10. Yeah.
Wow, okay. And then how much of a difference would this make?
Some people see immediate results in terms of not a complete posture overhaul. However, if someone did notice a little bit of tightness or an ache, if you do these activations, then it can help actually inhibit the tight structures because we're activating the opposite side.
Mm.
So basically, it creates a better balance between the push and pull of our tight and weak muscles, and that can actually reduce pain. So that's normally how I wow my clients in our sessions. A little bit more specific work comes with it as well. But even just by doing this, you will notice a big change. And
I'm already feeling more open. I'm not going to lie. And I think it was from the shoulder, like really the elbows back one, hands behind your head. I feel more open in my chest.
The body knows how to move. You just sometimes have to give it a little prompt.
Mm.
Yeah. And we don't spend time stretching our chest out. Our chest muscles are doing their job. Let's strengthen the lazy muscles on the back so then everything can work together.
Is it true or is it my algorithm that says that better posture makes your face slimmer?
Oh.
Is that true? This is a question without notice.
That's really interesting.
Or is that just like, no, you just need to work on your posture and benefits can come. But I know that I personally follow different accounts and it's like if you can fix your posture, you'll stand up straighter. So therefore it's like your face will your jawline may look a little bit slimmer.
I understand. So if your shoulders are down away from potentially, that can be an illusion. But I'd imagine
the illusion. Yep, that sounds like my algorithm. Yep.
All the clickbait threes. That's the thing with social media. There's rarely any context, and it's a lot of fear-based marketing and all of that. But honestly, I'm not sure about that one. I definitely wouldn't claim it, but again, it's all an illusion. Like with the bodybuilding and the poses, you manipulate your body in a certain way to make you look different.
But how would better posture, just in general, how does that improve our lives?
Well, we notice, again, back to the people watching, you can really tell if someone's had an amazing day because they're up, they're looking forward, shoulders are back, they've got a spring in their step versus someone who's had a really rough day, unfortunately. They're often shoulders down, looking forward. It's just that body language of, being closed off as well. So aside from feeling pain-free, I really think that working on your posture and how you hold yourself as a person has amazing benefits when it comes to your mental health and how you can interact with people around you, how you hold yourself in public settings. So there's just so many benefits physically and mentally to work on it.
How do you keep the commitment to yourself to do this regularly? Like, you admit yourself that sometimes these exercises may appear boring. How do you keep doing it every single day?
I remember what it feels like to not do it, and it feels horrible. Yeah. So the biggest motivator for me personally is to at least get them done before my training session. So myself, all my clients, even our staff at the gym, we all spend about 5 to 10 minutes before our gym training session priming our body. We do our mobility. We do some activation work, kind of similar to what we went through, even though that was maybe more based for an office worker on a chair. We get down on the ground, do our movements, and then you notice how much better your actual training session feels in terms of not just being pain-free, but then you're hitting numbers that you haven't hit before. It's very motivating. So it just becomes a part of your routine, just like brushing your teeth in the gym. Brushing your teeth in the gym.
I was like, oh my God, I've got to start brushing my teeth in the gym. Yes.
No, brushing your teeth, well, wherever you are, but don't do it at the gym, okay? Brushing your teeth every day in the gym, we do our activations. It's just part of your routine because the consequences don't feel good. So that's how I sort of, aside from giving context to my clients or patients, if I meet them for the first time, we do our testing. Does this hurt? They'll say yes. Apply an exercise intervention, retest. Oh, it doesn't hurt anymore. There's your motivation.
Can you tell if people don't do their homework?
Yes. Yeah, because they're still in pain. Or they look, not much has changed. So
I ask so one of my friends once said, it's like, turns out all of those exercises that you get from either the gym or your osteo, your physio, if you actually stick to them, really makes a difference. Who would have known?
Exactly. But the art is convincing and selling the idea to the client. It's finding a communication style or a style that will resonate with them to really take the time, because it is a commitment. And you're actually, because people think, oh, I don't have time to warm up. Well, personally, I would rather you spend that 10 minutes on your warm up and cut 10 minutes off the end of your session. Because if you warm up, the quality of those movements that you perform in the gym will be so much better. You'll actually get so much more out of it rather than skipping the warm up and training longer in the gym.
What about people who say, going back to the whole concept of movement is medicine, there's always something that can be done. Is that right? As in, people might be like, okay, well, no, but there's actually nothing I can do right now. I'm too incapacitated. I'm in too much pain, X, Y, Z. Can there be something for them to do?
I personally think so, because the art is in regressing to a point where I've had someone with really severe lower back pain and they did a simple plank on a wall. Like, they were pretty much vertical, but with just a slight, incline or decline, whatever one it is. And that was their movement. And it's just, there's literally always something, or even standing up and then with a glute band. Glute bands are your best friend. We should all get a glute band.
Really?
Another one, yeah. So when you're sitting down in your office, pop your glute band around your knees and pushing your knees out. That gets your glutes active for when you're sitting as well. But that's in extreme cases, but we don't discriminate with exercises and rehab. So I treat a lot of lower back pain with deadlifts on a barbell, or I treat a lot of shoulder pain with a bench press. So there's really no, I know people stereotype rehab to be boring and band work and all of that. Okay, there's a time and a place for that 10-minute sequence. However, the next part of the rehab's actually in the gym, on your leg presses, doing your squats, doing your bench press. Every single movement is rehab when done correctly. So that's what we really, I think our point of difference is when it comes to how we get awesome results with our clients, because they often get shocked when we say, okay, get on that bench press. You got shoulder pain? Let's go. This is how we make it better.
How can people find you? What is the best way to get all of the insights from Dr. Dani?
I think Instagram's the best way. So at Dani Antonellos, that's where all my websites are, my podcast. You can book in an appointment if you wanted. So we're really just trying to get that message out on all platforms that we can, because, yeah, there's a lot of advice online that can be misleading. And I think with the emergence of social media, things are getting taken even more out of context. So, yeah, if you want more long form, obviously the Fernwood podcast, but then just on my Instagram, you'll find all my links.
And final time, the one message that you want the woman listening, the person listening to take home?
Movement is medicine, and there's always something that you can do.
Dr. Dani, thank you for joining us on Fernwood Unfiltered.
Thanks for having me.
We'll see you in the next episode. Thanks for listening to another episode of Fernwood Unfiltered. Just a quick note that the information shared in our episodes is for general educational and informational purposes only. It is not a substitute for professional medical advice, diagnosis, or treatment. So always seek the guidance of a qualified health professional regarding any medical condition or concerns you may have. Catch you in the next episode.
Thank you for tuning in to Fernwood Unfiltered. If you learned something from this episode, help support the show by hitting follow and leaving a quick review. It's free, takes 30 seconds, and helps more women find us. Thanks again for being part of our Fernwood Unfiltered community. We'll catch you in the next episode.